Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here once again with Dr. Zahra Figueredo. How are you, doctor?
Very good, Luis. Thank you so much. It's always a pleasure speaking with you.
Thank you, doctor. It's nice to be here recording. We do have two interesting topics today, but we are going to talk about spinal cord injuries. And I do have some questions for you, doctor. Can you tell us what exactly is a spinal cord injury?
Yes. Basically, a spinal cord injury is a pretty severe condition, not always necessarily the cause of a disease condition. Very often it's an injury. More often than not, it's some kind of an injury from, we've had patients with boating injuries, Gulf War veterans. We've had, car accidents, just sports, absolutely. Freak accidents where there's some kind of spinal compression leading to an injury where the spinal cord may be partially or completely severed. Okay, so that's what we mean by spinal cord injury. In disease conditions such as tumors, if there's a cancer that has affected the spinal cord, or sometimes we have impingement on the spinal cord from a bone or whatever it might be. Those kinds of conditions is what we are talking about when we consider spinal cord injuries.
In this case, doctor, what will be the approach with the stem cells, with the stem cell treatment to treat spinal cord injuries?
It is very, very comprehensive, our approach, and I'm sure listeners have heard me before talking about our comprehensive approach. In this case, with spinal cord injuries specifically, it's really important that we hit the central nervous system in several ways. And that means that we are, again, my motto is to leave no stones unturned. So that would be intrathecal application of stem cells, which means we apply the stem cells right into the cerebrospinal fluid that surrounds the spinal cord, and we make sure that that is done below the level of the injury. So if there's an injury, if we have a paraplegic patient that has had injury at the lower thoracic level or at the lumbar level, we ensure that the stem cells are placed below that, so that we can ensure that the stem cells are getting to the point of injury. So that's number one. And number two, we apply the stem cells intranasally, which is through like a nose spray of stem cells. So that bypasses the blood-brain barrier and directly gets into the brain and the central nervous system as well, into the cerebrospinal fluid again, as well as intravenously with mannitol. And that allows the stem cells again to penetrate the blood-brain barrier, which is this natural defense mechanism of the body that is a great thing because it keeps bacteria and viruses out of the brain in most cases, and other noxious chemicals and toxins. But in this case, we want the stem cells getting to the brain. So it's really important that we ensure that they're getting there, and this is how we do it.
How can we say that this approach will be successful in this case for spinal cord injuries?
It's very important, Louise, that patients understand the importance of a very, very important, good, clean diet, as well with the right specific nutrients that are nourishing for the nerves and the spinal cord, as well as it's really important rehabilitation. So a lot of patients, they think that they can come and they can do the treatment and miracles will happen. And you know what? I have indeed seen miracles happen. However, it's not without work. Okay, sometimes patients even require 2 or 3 treatments to get from being completely bedridden to getting on their feet and maybe taking steps and walking. Feeling I've seen come back perhaps after one treatment. I've seen toes wiggling after one treatment. Sometimes it takes more than one treatment. That's number one. Number two, again, the work on the part of the patient where the rehab comes in, and that means pretty important. Um, um, good rehab in order to get results, because the rehab is very important with stem cell treatment, especially in this case with spinal cord injury.
And we can say because stem cells are anti-inflammatory, they are also very useful to these type of treatments, right?
That's right. When we have spinal cord injury, because of what becomes of the patient, they're so obviously in most cases they're so sedentary. Um, their diets tend to suffer. There's a psychological and emotional a taxing element as well, which can affect their diet, and it can affect inflammation just in and of itself, because stress and emotions can really affect the patient in this case. So yes, anti-inflammatory markers are something that we measure, and yes, just um, addressing these mental, emotional, and psychological aspects of a patient's well-being is so important. I'm sure patients have heard me say that our well-being is not just our physical body in any situation, in any illness. And so this is really important. That's a really important point that you brought up, Louise.
Did you apply locally as well, the stem cells locally? And do you do it by yourself, or do you have someone that does this type of work with you?
Oh, yes. So we have a specialist that does the actual injection
Okay.
into the cerebrospinal column. And we have respective specialists in each field that take care of these specific injections and address these specific issues. So it's a team that we have here that's really, really important, so that we have the best of each field in their respective fields. So, and we apply the stem cells locally in the sense of the anatomical body. So yes, it's super important that as much as we possibly can, we want to apply the stem cells as close to the injury as possible. So in this case, yes, they're placed right at the site of injury. We're not injecting into the spinal cord, but we're placing the stem cells at the site of injury into the cerebrospinal fluid.
So, doctor, how would the stem cell therapy help to show a more promising outcome?
Yes, Louise, that is a really important question, because what makes us so unique at the Stem Cell Healing Institute is we do a pre and post treatment protocol. And this prepares the body, prepares the stem cells, depending on the type of stem cells we're using. It really readies the body for the best possible results, and prepares the stem cells for the best possible results. So that involves a detoxification, a very gentle yet effective detoxification with intravenous nutrients and antioxidants, as well as organic suppositories that work in conjunction, B vitamins. We do oxygen therapy as well. For a spinal cord injury, for a patient that is immobile, we will use a hyperbaric chamber. We will also use growth hormone therapy, as well as a stem cell enhancement formula that is specifically formulated for that patient, for each specific patient. And of course, as I mentioned earlier, we do not leave uh, we don't leave out the aspect of mental and emotional and psychological well-being. So this is really important pre and post treatment in getting the best possible results.
Excellent, doctor. I don't know if you want to add anything else to this podcast.
Yes, we can perhaps mention that this is done in Guatemala because of the jurisdiction in the US and Canada. Again, this type of treatment is not allowed, so we do this in Guatemala very safely and very effectively. And Guatemala is a destination country with a lot of tourism, and so it's really important that patients also understand that. And we do it very ethically priced, and it's just a lovely place to visit as well as get your stem cell treatment.
And just to give you a little more information about Guatemala, Guatemala it's a very modern city. It's not like you're gonna come to the jungle or anything like that. So we're gonna show you some pictures about the city, and you can see that it's a very modern city. We do have a lot of touristic attractions here. Antigua, Guatemala, which is one of the doctor's favorite places to go.
That's right.
It's World Heritage
For UNESCO.
by UNESCO, yeah.
Yes.
And it's only like 45 minutes away from the city. And we also provide a chauffeur that you can have it at your disposal, at your...
That's right, at your disposal. We have a private chauffeur for our patients, as well as we provide accommodations, which is really important. So it takes the worry out of the travel for patients, and very, very comfortable accommodations. And we also help book excursions as well to the ruins, like the Mayan ruins and Tikal, where Return of the Jedi partially was filmed, as well as Antigua and other places around Guatemala that are the country that are just beautiful to visit. The volcanoes and the coffee farms, one of my favorites.
Well, doctor, I appreciate your time, and I will see you next week.
Yes, thank you so much, Louise. Always looking forward to it.
You take care, doctor.
Thank you. You too.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.